Puerto Rico Action Plan. Access Health for Homeless People Response to COVID-19. CDC says people experiencing unsheltered homelessness, those sleeping outside or in places not meant for human habitation, may be at risk for infection when there's a community spread of COVID-19. According to the most recent statistics of Puerto Rico, there are 2,535 homeless people currently. This population suffers from lack of access to health. We have noticed that during the pandemic, many homeless people do not have the resources for preventive measures of SARS-CoV-2 virus, which increases their clinical, social, and epidemiological vulnerability to COVID-19. They mainly lack the use of masks and hand washing materials. CDC established that planning and response to COVID-19 transmission amongst people experiencing homelessness requires a whole community. 4-H programs should be a part of that community efforts, especially in Puerto Rico, where levels of COVID-19 are classified as very high by CDC. To address the issue of health equity for the homeless population related to access to resources to prevent COVID-19, we propose a project with 3 levels of interventions: micro level, community level, and macro level. At micro level, individuals can take actions to help homeless people. At 4-H, we plan to share prevention supplies with homeless people at local communities. This may include disposable masks, soap, hand sanitizer, and foldable water containers. At community level, people get together to attend common issues. At 4-H, we expect to join efforts with governmental and non-governmental entities to learn how to reach out homeless people to prevent COVID-19. Macro level is the most determined scenario to make possible health access for homeless people. We plan to do advocacy at the legislative and executive branch of Puerto Rico government to discuss this important issue of health equity. This is how we plan to do it. At phase 1, we are going to recruit 4-Hers. Also, we will collect donations and buy prevention supplies. At phase 2, we're going to train 4-Hers about the key concepts like homelessness and health prevention measures. Also, we're going to do an advocacy event, 4-H Summit for Homeless Access to Health, to discuss and interchange concerns with decision makers. Then at phase 3, each 4-Her will be going to implement actions at local communities like health education demonstrations and sharing COVID-19 prevention supplies with homeless people. After the implementation, we will do phase 4, which consists of evaluation using 4-H citizenship common measures. Then we will disseminate results and share an achievement report. To disseminate achievements and recognize 4-Hers service, we will do an achievement event. This plan will be executed starting in July 21 to June 22.